I'm very pleased to introduce Dr. Susan Boiko. Please go ahead.
I'm thrilled to talk to all of you today, and I have a special shout out to Howard because I was supposed to be in touch with him about 15 years ago about sun safety programs for school health, and I'm finally getting to meet him tonight. Okay. So I'll talk to you about that later. So it says the co-host has asked me to start my video, but I don't have a video.
Can you turn on your camera, Dr. Boiko? Down in the bottom left.
Oh, that video.
Yes, ma'am.
Okay, thank you.
Okay, there you are.
Awesome. Hello, everybody. This is the only opportunity I have to make my bed every day from all these Zoom meetings. So now my house is cleaner thanks to you. So Kirsty, could I have the next slide, please? I don't have any disclosures tonight. And the next slide, please, Kirsty. And by the way, Kirsty, thank you very much for changing my slides because I have an itchy trigger finger and I always go too fast. So if you don't have this by now, and I'm 67 and I've started to get a few little blemishes here and there from my sweaty masks. This is a new condition called maskne. And this is not caused by COVID, but it's caused by wanting to protect yourself from COVID. And so you can see the different kinds of masks, shields, gloves, gowns, and eyewear can give you all these different symptoms, and especially these breakouts. And if you'd like to ask me in the questions later about what to do to help this, I'm happy to talk to you about it. But many of you may be suffering from this, and our children and teenagers in schools, and as they go about trying to play their sports and trying to do activities with a mask on, may be suffering from this as well. Next slide, please. So the reason I call this slide the retrospectoscope, for those of you who don't know what that is, it's like Monday morning quarterbacking. It's like, what should I have known or what should I have seen? I want to tell you a little story that looks like these pictures. In late February, I got a call from my internal medicine doctor, and she said her neighbor had seen a dermatologist with, and she sent me pictures, which I immediately deleted from my phone after she sent them to me, after I looked at them. And of course, Dr. Eichenfield, our dear leader at Children's, taught me to say, I can't tell you about yourself, but in other people I've seen with similar appearances, it looks like. So this man was an international traveler. He'd recently returned to North County, and he had this rash. He'd gone to see his dermatologist, and the dermatologist told him that it was Raynaud's syndrome, but he didn't have any symptoms except for a little bit of the swelling and a little itching. And he really didn't have anything on his hands. And it had just come up, and they were wondering what it was. And so when I used to practice in Cincinnati, I had a little talk that I give to kids in the winter. And I'd say, you know, you have cold castle syndrome. The princes and the princesses would wander about the castle on the cold stone floors in the winter. And they would get these. If you read Jane Eyre, she had chilblains or pernia. And so I said, well, that's what it looks like. It's really unusual. He wasn't in a cold climate. But, you know, I think if there's any question, maybe they want to do a biopsy, but I don't usually recommend it, and usually it gets better by itself, and just see what happens. So all of a sudden, the media explodes. And you can see in these pictures, and the reason I'm leaving the pictures up for a second, I'm going to just show you picture after picture like this, is if you haven't seen it, you will, if you're in certain populations. And even if a COVID test is negative, which it sometimes is, and maybe Mark can talk about that a little more, or Howard in the question and answers about false positives and false negatives, you can still see this. And sometimes it seems to come up after symptoms, but it can come at any time in the course of the illness. And you see this, what's called acral erythema. You see just that kind of pinkish red color, almost as if they stuck their toes into red Kool-Aid. You can see a dactylitis pattern where they have inflammation of just one toe. You think about cellulitis, all kinds of other possibilities, bug bite on that toe. Then you see this kind of mixed pattern. Sometimes there's actually little vesicles or hemorrhagic crusts. And let's go to the next slide, Kirsty, please. So again, pernio or chilblains is this redness, this erythema. So if you're a dermatologist, you'll say erythema. If you're a pediatrician, you'll say redness. Edema, sometimes blistering and ulceration. And don't forget that it's also on the nose and cheeks. Since we live in this climate, if you go up to the Mount Palomar when it's winter time, you may get it on your face too. And it's vasospasm, but nobody really knows the exact mechanism of the vasospasm. They think maybe it's local hypoxemia, and then there's a secondary inflammatory response, but it's really unknown. And here's Jane Eyre. Our clothing was insufficient to protect us from the severe cold. We had no boots. The snow got into our shoes and melted there. Our ungloved hands became numbed and covered with chilblains, as were our feet. And I think we should think about our homeless population, including children. Even in Poway, it can get down in the 20s and 30s sometimes in the winter. So think about, we have inadequate heat in our buildings. Some houses don't have any central heating. And so we might just see this, but I have to say, in practicing here in San Diego for maybe 25 years now, maybe I've seen 2 or 3 cases and teenagers in the youngest. So let's go on to the next slide, please, Kirsty. So 6 months ago, I feel like it's just been 2 days. I'm in this like COVID haze. I stopped seeing patients online in April when the volume of patients went down. And since I'm retired and just working 2 days a week, it didn't seem right to take the work away from the people that needed to work full time. So I feel like 6 months ago was 3 days ago. So pernio became associated with COVID-19. And I say it should be SARS-CoV-2. It's kind of like potato or potato. So even though I'm saying COVID-19, just think SARS-CoV-2 if you like that better. So here's how we know that it's not something else. It's not lupus because their lupus tests are negative. They don't have any other physical signs or symptoms of connective tissue disease. They don't have a genetic interferonopathy. They don't have cryoglobulinemia. They don't have cold agglutinins. And people have actually done the studies on these patients, including a group of patients in Italy where they got coags, CBC, chemistry, lupus anticoagulants. And out of the 16 children that they tested, only 1 had a positive D-dimer, but was otherwise completely healthy. So if you see this pernio or chilblains, you want to talk to the patient and say, you might consider self-isolation following the CDC guidelines. You can get the COVID testing, and let's go to the next slide, please. Here's how to take care of it. First of all, is there a way that we can see raising hands on here? There's not a raise hand function.
Hi there. If folks go to the participant box, there's an option to do yes or no. If you can phrase your questions in that manner, you can get a vote.
So what I'd like to do is see how many people have already seen this in their practice, their families, or their community. And then Kirsty, can you let me know what, how many people have said yes? I see a no in the chat.
So this is Megan here. I'll give you a quick check. So far I have 3 yeses and 44 no's.
Okay, great. So you're like me, because really the only case I have seen probably associated with COVID in that business traveler was that illegal patient that was sent to me by my internal medicine doctor. So I have to rely on the literature for these pictures. So the American Academy of Dermatology says that if you have skin lesions of pernia without other COVID-19 indications for urgent evaluation, can be managed with careful consideration of not overburdening local emergency room sources. So here's the careful consideration that many of you have the opportunity to shoot a picture to a dermatologist and the kid is otherwise feeling okay. And we, dermatology in my group would welcome, obviously, your questions. And if you're with another group like Kaiser or Sharp or Scripps or something like that, I'm sure their dermatologists would be happy to look at a picture and advise you to. So the recommendation is to use a medium to a high potency topical steroid for no longer than a week. So probably a 15 to a 30 gram tube with no refill would be fine for the pain, the itching, and the inflammation. And the Italians and Spanish experience, actually, they use antihistamines for itching. I don't personally find antihistamines helpful for this kind of itching, but they may, have some use as sedation if kids are having trouble sleeping, if they're uncomfortable. And then some local wound care with just topical petrolatum and bandages for ulcerated areas. So next slide, please, Kirsty. So these are pictures of age 18 and older, but they certainly apply to the children that we're seeing too. And this is the severity of COVID as you go from the green area on the left and you follow the arrow to the red area on the right. Mark, can you turn on your microphone for a second and let me know if you have seen any of the kids? I'm going to talk about MISC in a second, but have you personally seen any kids that we've had at Rady with this retiform purpura?
I have not personally. I have seen the toes that you described earlier, but not this rash.
Well, that's great because I know in New York, some of the children who were very seriously ill ended up having that. So let's go to the left, and we had talked about pernia or chilblains with mostly the feet and the hands and the pain, burning, itching. Only 50% of those had other COVID symptoms and happened afterwards. And then here's the ones that the symptoms they had were fever, cough, asymptomatic. And then I think the hospitalized number reflects the fact that this is part and parcel of an assault on your body, including having this inflammatory response that Mark talked about before. Now, here's the tough thing. And when you look at this vesicular, urticarial, macular erythema morbilliform, it's sort of like everything in your pediatric textbook in the picture section could be associated with COVID. So you want your index of suspicion to be very high. Just like syphilis was the great masquerader, COVID now could be the great masquerader. And so look for other COVID symptoms and then look to see if these things seem to come out afterwards. And again, the hospitalization reported is probably because, they're in the hospital and they're looking at their skin more. And sometimes there'll be an evanescent rash and the kid will otherwise be fine and the parents won't even say it. So I think this is kind of the tip of the iceberg. And then of course, the worst is this retiform purpura. The word retiform means net-like, like reedy ridges, kind of pegs. And on the extremities and buttocks, which are more dependent areas, it can be asymptomatic, but it's much more serious vasculitis. So let's go on to the next slide, please. So in children that have COVID-19, in Spain, they had 37 patients. So they had a median age of 14 and the ages range from 8 to 37. So the toes only pattern was the most common, but surprisingly, the fingers only were the second most common. And the toes and the sides of feet, the toes and the heels, the toes and the fingers, the toes, fingers, and sides of feet. You can have all, one from column A and one from column B. You can have all different morphologies. Next slide, please. So again, you can see this erythema that's right on the dorsal foot and a little edema. You can see the nails look pretty normal. And remember that this is going to get better. Next slide, please. One other thing that I don't want to forget to mention to you as we're going along is every picture you see in this talk is accessible to you. And if you're giving talks, you can just download, it says, you know, when you pull up the article, the PDF, it'll say slides. So if you want to teach others, you can get these pictures too. And certainly once you have this material, you're welcome to share it with whoever you like. Next slide, please. So, you know, if you just look at one little pink mark on a foot and, oh, he just bumped himself, or he just bruised himself, that could be a nevus, it could be a vascular malformation. So the history is really important. Like, did this just come up or has it been there for a long time? And sometimes it's impossible to know what it is without a biopsy. And so some of these things, we will photograph them and then like see them back in a week or 2 weeks. If it's not getting better, then we might consider biopsying for diagnosis. Next slide, please. So once again, look at how different the pink and purple color is in each image. And you notice that these are kind of light-skinned people. I have some images of people with darker skin where it's a little harder to see the redness. And you can see how important really good lighting is. So take a look at the fingers. If you just saw that on the fingers, you'd have a lot of different possibilities. So always good to get that COVID symptom history. And on the toes, again, it almost looks like they were dipped this time in purple Kool-Aid. If you just saw the toes like that, you might think they were cyanotic. So go ahead and gently palpate them. They may be tender, but they shouldn't be blazing hot. And then do you see the hemorrhage on the ankle? That almost, you know, looks like maybe they bumped themselves against something, but why would it wrap around the ankle in that strange way? And you'd see the edema of the prominence of the creases at the posterior ankle. Next slide, please. So again, here are the children, and here's the redness, the purpura, the purple, and you can even see, do you see in lesion D, do you see my arrow here? There's little vesicles. And one really tough thing about these eruptions, this is the most typical of COVID, and that's why I'm showing it. But COVID can have urticaria, and you know, think about the thousands of urticarial children you've seen. You can have just a morbilliform eruption. Gosh, is it a drug eruption? What is it? They could have petechiae, they could have vesicles. People describe them as looking like chickenpox. To me, this doesn't particularly look like chickenpox. And then they can have livido reticularis, or that net-like appearance that's more common in adults. And next slide, please. And one reason to show you this picture is if you're not familiar with the Dermascope and you really like to enlarge your horizons and have a lot of fun learning, I highly recommend that you get one and take a course for pediatricians and family doctors and how to use it. It's like the most awesome magnifying glass that you can see interesting changes in the skin. So you see here in picture A, the little picture of the toe, and then you can see a really close-up magnified picture. And you could even see the lines here. And sometimes you can see the individual dots in the sweat glands too. And then here's this toenail, and you see this ragged cuticle. You can see the nails broken off here and the little scaling here. And you can see this patchy erythema. And again, look at those skin lines. So you can really get a lot of good detail. Next slide, please. So again, as we talked about, be suspicious. You know that cheer, be aggressive, be aggressive. I want you to be suspicious, be suspicious. So remember urticaria, morbilliform eruption, red patches or vesicles healing with crusting? Think about the possibility of COVID. Next slide, please. And then this is actually a physician. Remember that even though we're healthcare providers, we ourselves can also get sick. And so if you're working or you're home with somebody who's symptomatic and suddenly you get urticaria, maybe you want to get a COVID test. So here's this doctor, and you can see on her forehead the erythematous plaques, the little papules, and coalescing into plaques on the hands and dorsal feet. Next slide, please. And this child is supposed to have a varicella-like exanthem. Again, it's hard to say this is a raindrop on a rose petal because you don't really see the raindrop too well. It almost looks more like insect bites to me. But this was, again, an early case where they called it a varicella-like exanthem. Next slide, please. So now there is something that mainly parents on the East Coast have faced, and also in some areas of LA and San Francisco, where children have a very challenging presentation where they can either have Kawasaki-like symptoms of skin findings. They can have the rash, the bloodshot eyes, the swollen hands and feet, the cracked lips. I don't really, when I look at a strawberry, I don't think the tongue looks like a strawberry. It looks kind of just denuded. And large lymph nodes compared to toxic shock, where they look like they have a sunburn rash. They have the low blood pressure and a really high heart rate. So next slide, please. So here are some images that may help you figure out how to classify this, but usually it's a team approach. I think Mark, if he saw somebody that looked like this, he'd probably be calling the dermatologist and we would be calling Mark. So you have the extremity edema that we talked about. I hate this word maculopapular because macules are just flat spots and papules are just bumps. So it's kind of both. The tongue rash, it's not an eye infection, it's injection. I don't really know why they put infection there. And then the rash on the hands and feet. Next slide, please. And here's some images of that. You could see the lower lip is edematous and it's starting to desquamate. In letter B, there's a little erythema of the conjunctiva. There's no discharge. Letter C, it almost looks urticarial. Letter D, do you see how you can see the vessels? And then there's some patchy erythema there. Next slide, please. And then it almost looks like a heliotrope rash on the eyelids, like dermatomyositis, but it's much more acute and the children are much sicker. In picture F, you can see the palm is desquamating and erythematous. In lesion G, you see how frustrating this can be if you don't have a background of understanding and the other symptoms, because if you look at these things individually, there's all different possibilities. Lesion G just looks like a little urticarial or maybe even an eczematous plaque. And lesion H, you can see some petechiae as well as some erythematous papules. Next slide, please. So even though hemangiomas have nothing to do with SARS-CoV-2, if you have a patient who has a hemangioma that needs medical attention, there is a wonderful handout on the Pediatric Society for Pediatric Dermatology website that's available to anyone who would like to read it. And so I've put this reference in your handout. And next slide, please. And these references are all available to you. So if you just click on these links, you should be able to read them. Next slide, please. Next slide, please. Next slide, please. And of course, the wonderful AAP website for people who are not members of the American Academy of Pediatrics. All of this information on coronavirus is available to you, even if you are not an AAP member. And even better, most medical publishers, if you use a search engine, you could use Google Scholar, you could use PubMed, and you want to look up COVID-19, instead of the little box that says, you must pay $19 to rent this article for 7 hours. you get to look at it for free in toto. You get to read the whole article because it's about COVID-19. And finally, I want to tell you about something that is not on these references that I just discovered today. So I'll give you a second to get your pens and pieces of paper out. And just to let you know, if you have Visual DX, they have much more available images of children with different skin tones and these findings. Remember that the darker the child's skin, the less likely you are to see erythema. So you need really good lighting. And if you're doing a telemedicine consultation, have the parents take really sharp pictures in good focus before the visit. Have them send the pictures because it's really hard to see redness and video on a moving child. So this is the website. It is the COVID Symptoms Study. And it's https:// COVID skin signs, all one word, COVIDSkinSigns.com. And that is a combination of Massachusetts General, the Harvard School of Public Health, King's Cross Hospital in London, and Stanford University. They have put the most incredible pictures. Again, unfortunately, most of these pictures are of people that are very light-skinned, but fortunately, there's a wide variety of pictures. So don't just look at these pictures. Look, the more you look at varieties of pictures from various sources, the more confident you'll feel in what you're seeing. And again, please shoot us a picture. Thank you so much. It's my pleasure to speak to you, and I only wish I could see your smiling faces. Have a great evening, and I look forward to questions.